Hello and welcome. This is lesson number 2 of the Gut and Psychology Syndrome lesson series. These lessons were written by Dr. Natasha Campbell-McBride, who devised the concept of Gut and Psychology Syndrome, and they're being presented by me, Sarah Hanratty of the Brain Food Clinic. So let me introduce you to Gut and Psychology Syndrome. The condition established the connection between the health of the digestive system and the functioning of the brain. And as I said, it was Dr. Natasha Campbell-McBride who created this concept in 2004 when she published her first book, Gut and Psychology Syndrome. So, lesson number 2. So what kind of health problems are we talking about which fit into the GAP syndrome? We start with children. We're looking at autism, ADHD with hyperactivity or without it, dyslexia, dyspraxia, a large group of various learning, behavioural and social problems which don't fit into any real diagnostic box but do cause problems for the child involved. In fact, around 80% of children referred to the psychiatrist are in this group. They may have a few features of autism or some attention deficit, a bit of dyspraxia, a bit of dyslexia. Every child is different and may present with a different mixture of symptoms which don't fit a defined diagnosis. So these are the children with whom professionals procrastinate. They ask the parents to bring them for observation again and again, hoping that a picture would emerge which would fit into the diagnosis. While this is going on, valuable time is being wasted when the child could have been helped. So Dr. Campbell-McBride believes that childhood epilepsy in the vast majority of cases is a GAPS condition and should be treated with the GAPS nutritional protocol. Indeed, a majority of childhood epilepsy cases are called idiopathic, which is a medical term for we have no idea what causes it. Clinical experience and research shows that seizures are a result of toxin accumulation in the brain, and in GAPS patients, these toxins come from the gut. This toxicity initiates abnormal electrical activity in the brain, which can show itself as epileptic seizures or various tics and involuntary movements. Tourette syndrome and various other fits are also in this category. The second edition of the GAPS book has a chapter on epilepsy explaining this issue in detail. I just want to add here actually that my son, he's now 12, at around the age of 5, he developed these very, very abnormal tics that were later considered to perhaps have been minor seizures. And it was only really through working on his gut health and trying to move out various pathogenic bacteria that we were able to see the tics and the seizures lessen and eventually disappear. He hasn't had those kind of issues in years now. When GAPS children grow up, unless they receive appropriate help, they become GAPS adults, and substance abuse is one of the problems they're prone to. The basis for all addictive behaviour is abnormal production of neurotransmitters in the body, such as serotonin, dopamine and epinephrine, and many others. A large percentage of these neurotransmitters can be produced in the gut. GAPS children and adults have this problem most of their lives. It is the peak production of neurotransmitters that allows us to experience emotions such as happiness, joy, exhilaration, etc. If your body is unable to produce enough neurotransmitters, you cannot experience these emotions to the full. You just can't quite get there. And as a result, it's dull for these people. Addictive substances such as heroin, cannabis, other psychotropic drugs, sniffing glue, abusing alcohol, or just smoking cigarettes, etc. And addictive behaviours, reckless or risky behaviours, these can give the body the boost of neurotransmitter production, allowing the person to experience emotions to the full. The effect of these influences doesn't last though, and then the person wants to experience that again, and hence the addictive nature of these influences. There's also a psychological factor leading GAPS teenagers to trying substance abuse. They spend their childhood feeling inadequate at school, having difficulties in social situations, often being bullied and called names. So their self-esteem takes quite a battering. When they get to their teens, they will do anything to have friends, to fit in, to be popular, to be invited to parties, and substance abuse is one of the avenues they may take. Eating disorders Anorexia nervosa in particular is a group of conditions, we're looking at conditions where the perception of self is altered, and in majority of cases, these are GAPS people and they should be treated appropriately. There's a chapter on this condition in the GAPS book. People with eating disorders may develop their problems from different starting points. Some have been GAPS people all their lives. Some try to lose weight through choosing inappropriate diets. And these life choices undermine their immunity, leading to frequent use of antibiotics, consequent damage to the gut flora, and development of GAPS syndrome. And then we're looking at various psychiatric conditions: depression, obsessive compulsive disorder, bipolar disorder or manic depressive disorder, maybe schizophrenia. They're all due to toxicity getting into the brain and altering its functions. Clinical experience shows that most of these toxins come from the gut, so many of these patients are GAPS people. The father of modern psychiatry, Philippe Binel, concluded at the top of his professional life, the primary seat of insanity generally is in the region of the stomach and intestines. And Dr. Campbell McBride came to the same conclusion in her work. Adult epilepsy, including various non-epileptic tics, fits, and involuntary movements, is not that much different from the childhood epilepsy, although it's more difficult to treat, as these patients usually have had years of anti-epileptic medication use. Most of these drugs are addictive and really difficult to withdraw, and some of them can cause epilepsy. However, the GAPS nutritional protocol can be very helpful with these patients too. So when we examine GAPS patients, we find that they not only have problems with brain functioning, but they're physically ill too. These are problems most commonly observed. Digestive problems are universally present. In some patients, they are so serious that before talking about mental problems, quite often patients want to talk about their diarrhea or constipation or bloating. All digestive symptoms are a clear indication that the person has abnormal gut flora, which is damaging the gut wall, causing inflammation and irritation there, and interfering with proper digestion and absorption of nutrients from food. In some cases, GAPS people may not have had pronounced digestive symptoms. However, if we look at their health history, we find that they had them on and off most of their lives. Dr. Natasha had a few cases in her clinic where people with psychiatric problems never had digestive symptoms, but when put on the GAPS nutritional protocol, they had great improvements in their mental functioning. The reason for this is our bodies have a great ability to compensate for problems, so one can have quite a bit of damage in the gut and have no pain, diarrhea or any other symptoms, as the body compensates for the damage. Only when the damage gets to a certain point do we start getting digestive symptoms. So these people may not have digestive symptoms, but have enough damage in their gut wall to allow toxins through. Toxins, which then get into the bloodstream and into the brain of the person, causing mental problems. About 85% of all immunity is located in the gut wall, so our digestive system is a major immune organ. And there is a constant conversation going on between the gut flora and the immune system. The role of the gut flora in immune function is monumental and shouldn't be underestimated. One of the major roles of the gut flora is keeping the immune system in the right balance. There are two major arms of the immune system. They're called Th1 and Th2. The Th1 arm is responsible for normal reactions to anything in the environment: dust, pollen, microbes, food, drink, animals, chemicals, etc. If this arm of the immunity is working well, then you can be in contact with anything in the environment and have no abnormal reactions. The problem is that this arm of the immunity is kept strong and up to doing its job by your gut flora, and if your gut flora is damaged, this arm becomes disabled. So the second arm of the immunity, the Th2, tries to compensate for its disabled brother and becomes hyperactive. The Th2 is responsible for atopic / allergic type reactions in the body, and it cannot deal with the environment appropriately. So you start developing allergic reactions to pollen, dust, animals, foods, chemicals, etc., all because your gut flora got damaged and it's unable to keep those two arms of the immune system in the right balance. GAPS patients universally have allergies and abnormal reactions to environmental influences. When the gut flora is abnormal, the immune system is compromised and cannot function appropriately. Asthma and eczema are particularly prevalent amongst GAPS children due to their compromised immunity. Malnutrition is universally present amongst GAPS patients. Some of them look malnourished, pale, thin, anemic. Some may look okay, but when we test them, we find severe deficiencies in all the essential nutrients without which the brain and the immunity cannot function. It's not surprising, because in these people the gut is unhealthy and cannot digest and absorb food properly. Bedwetting, thrush, and chronic cystitis are very common amongst GAPS people. These three conditions are related. The abnormal gut flora in GAPS people produces hundreds of toxins which absorb into the blood and then leave the body through the urine. As this toxic urine accumulates in the bladder, it causes inflammation and irritation in its walls. This manifests as chronic cystitis, where the urine test can't find any infection, but the person has all the symptoms of cystitis. The frequent urination, small amounts of urine, unpleasant sensations from burning or to milder irritation in general. If the child's fast asleep, in a deep stage of sleep, the bladder may get rid of the toxic irritating urine without waking the child up, so the child wets the bed. Many adults suffer from bedwetting as well due to this condition. Another factor here is the fact that the urethra, bladder, and other organs in the groin have their own microbial flora, which protects them from infections. And this flora will come from the gut. So if the person has abnormal gut flora, they would have abnormal flora in the groin as well. This leads to thrush in that area, frequent bladder infections, vaginal infections, and other problems. The combination of abnormal flora in the urethra, the bladder and the groin, and toxic urine accumulating in the bladder cause chronic cystitis, thrush, and bedwetting in GAPS people. So Guttman-Psychology syndrome is essentially a digestive disorder, and these are the typical digestive symptoms that GAPS people suffer from. GAPS babies are very often affected by colic. Colics become so common amongst our babies that it's been almost pronounced as normal by the medical profession. Colics are not normal. It's a clear indication that the baby has developed abnormal gut flora, and if we don't deal with it now, worse problems are to follow. Various pathogens in the baby's gut convert food into gas, and as a bubble of gas accumulates in a particular part of the baby's gut, it stretches it and causes cramps, and so the baby cries until the gas dissipates or moves to a less painful part of the bowel. Bloating and flatulence are part of the same problem of gas overproduction, but in older children or adults. Stool abnormalities such as diarrhea or constipation are universally present and are a clear indication of abnormal gut flora. Some GAPS people fluctuate from loose stools to constipation. This problem can be particularly severe amongst children with autism. Feeding difficulties are a big problem, particularly in GAPS children, though many GAPS adults are affected as well. These people have solid physiological reasons for being fussy with food. The abnormal flora in their gut converts food into hundreds of toxins, some of which have a chemical structure of opiates, which give the brain a pleasure signal. So the brain wants more. As a result, these people become addicted to the very foods which damage them. They get trapped in a vicious cycle of cravings and dependency. They would eat foods which would feed this cycle and exclude everything else. The typical foods which GAPS people would eat are processed carbohydrates made from things made out of sugar and flour, breakfast cereals, starchy and sweet snacks, maybe an occasional banana or sweet yogurt. In the GAPS book, there's a chapter, It's Feeding Time, Oh No, which gives you a structured approach for dealing with feeding difficulties. If you have a go at this approach and see if you're able to pull your child out of this vicious cycle of cravings and dependency. Expect vigorous resistance from your child, because this problem is like a drug addiction. I remember Jenny McCarthy saying something like that about her son, who has autism, that she felt he was like an addict when it came to gluten and dairy. Dr. Campbell McBride had children in her clinic who would only eat 1 or 2 foods of a particular brand, and that's how she came up with this structured approach that she describes in her book. And these children are now eating a wholesome, varied diet. And I do find that once you take out those foods that your child's addicted to, slowly but surely their taste will expand and they will begin to accept many other foods. It does take time, but they do get there in the end. When the gut flora is abnormal, the gut can't digest the food or absorb it properly. The gut lining gets damaged and porous or leaky, letting through various partially digested foods. And the immune system finds these improperly digested foods in the bloodstream and it reacts to them. Reactions to foods or food allergies can manifest as any symptom under the sun, from itchy skin, sneezing, achy joints, achy muscles, headaches, depression, epilepsy, and psychosis. The reaction can be immediate or delayed, a few hours later, or days, or even a week or two later. And as a result, these reactions can overlap with each other, making it impossible to figure out what particular foods the person is reacting to on any given day. The key to dealing with food allergies and intolerances is to heal and seal the gut, so the food gets the chance to be digested properly before being absorbed. GAP's nutritional protocol has a good record of removing food allergies and reactions. Until recent times, people with psychiatric disorders and learning disabilities were not examined by gastroenterologists. Apart from a few reports in medical literature of a condition called fecal compaction with an overspill found on x-rays, that was really the only thing that was, occasionally identified. And this fecal compaction with overspill showed that in these particular patients with psychiatric disorders and learning disabilities, that their bowel was full of old compacted feces, and which literally glued to the gut wall. The food has to squeeze through a very narrow channel between these masses. So the stool that comes out of this patient is an overspill, and they don't empty their bowel properly. And these old fecal masses provide a perfect environment for all sorts of parasites to thrive and produce their toxins. But now this condition is found routinely in children with autism, in schizophrenia and other GAPS conditions. In the last 10 to 15 years, there's been a lot of research into the state of the digestive system in people with learning disabilities and psychiatric disorders, and in many cases an inflammatory bowel disorder has been found. Inflammation, ulcerations, enlargement of lymph nodes, etc. When the gut flora is abnormal, the digestion system, it just can't be healthy. So in the first GAPS lesson, we did take a little look at the role of the gut flora, and you can see there it's vital for immune system function. It's needed for detoxification, to protect the integrity of the gut lining, to prevent leaky gut, which leads to food intolerances, and of course it's really important for digestion absorption, and it also helps to produce some vitamins. But when we look at the gut flora of GAPS patients, we find it's very abnormal. They typically have virtually no beneficial bacteria present, or their numbers are reduced. Instead, their gut's populated by various pathogens. What we are finding now, as we look a little bit more closely at stool testing and looking at the microflora, what we're looking for are really high levels of beneficial bacteria, but generally a really, really good spread of lots of different types. That seems to be the healthiest gut flora you can have. But unfortunately, what we see more of are these sorts of bacteria. So we might see sort of overgrowth of Clostridium species, or too much yeast, or not enough of the good bacteria, not enough lactobacilli or bifidobacteria. And sometimes we see other bacteria hanging around the gut too. So this takes us to looking at the organic acid testing, which you can use. It's a urine sample. It's really simple and straightforward. One urine sample sent off to the lab, and the urine test, they look at certain metabolites in it in the urine to come up with results that show us how well our body is producing and metabolizing certain nutrients, for example, so it's useful in that respect, but it also identifies various toxins which are produced by the gut flora, get them absorbed by the bloodstream, and then they're excreted in the urine. So indirectly, this test can show us what pathogens might be lurking in the gut of the person. I find this quite useful, especially if collecting 3 stool samples for a stool test isn't ideal. And Great Plains, I think, who also run this test, will also test for oxalate levels as well. So there's a lot of information that can be gathered from the organic acid testing. And this includes high Clostridia levels as well. And it just gives us a really good clue of what's going on in a child or an adult's gut, and gives us quite a few key pieces of information on which to move forward with the program. Okay, so this is kind of a typical scenario of what goes on, how GAPS develops in a person. We can see that the babies are born with an immature immune system. They should establish normal gut flora, but they tend not to if they've been born to a mother who also has gut dysbiosis. And they're left immunocompromised, and they get infections, and then they're given antibiotics, and every course damages the gut flora further. And then we give vaccinations, and we've learned earlier on that some children aren't really in a good position to be vaccinated because their immune systems are already over-triggered or not functioning as they should. And these children can sometimes be damaged by vaccinations. Again, Dr. Campbell McBride looks at this issue in her book and suggests an alternative protocol when it comes to vaccinations. And then, of course, we give them the usual weaning diet of grains and processed milk, which doesn't help the gut flora in the slightest, and certainly in terms of being nutrient dense, it really isn't. It just can make the gut more inflamed. So you can see how over time, in fact, this is a really typical history of a child with GAPS syndrome. So this is the GAPS nutritional protocol, which we'll talk about in detail in the following lectures. The GAPS diet is the key treatment. The digestive system is a long tube, and what you fill that tube will have a direct effect on its well-being, and that's why diet is super important. Some supplements are also important, particularly probiotics. An effective probiotic is necessary just to introduce beneficial bacteria into the gut in order to drive out pathogens and re-establish normal gut flora. And detoxification is a third part of the treatment, but it's also very important, certainly for your comfort and to help you through the protocol. But we'll look at that in the next lecture.